Good hand washing technique. Could be a surgeon, I don't know yet. Oh, oh, oh. Well, calling for help is the right thing. That's the first thing you want to do in these types of situations.
His jugular vein's been cut. Does anyone have a clean cloth?
How does he know it's the jugular vein? That's pretty impressive.
That's great.
Putting pressure on a wound like this is the first thing you need to do outside of obviously calling for help. Anything you can do to stop the bleeding, put pressure on the site is important in order to help that person survive.
You're killing him.
I'm saving his life. He was bleeding out.
No, you have it in the wrong place.
I think I remember enough of Anatomy 101 to know what the jugular vein is.
Ooh.
He would be in the right place if he were an adult. He's not an adult. He is a boy, which means you're also putting pressure on his trachea, which means he's not currently breathing.
I can't really see where his hands are, but it's good advice.
There.
Don't take it out.
Some glass.
Don't take it
He'll
out.
be fine.
Yeah.
Who are you?
Hello, I'm Dr. Sean Murphy. I'm a surgical resident at San Jose St. Bonaventure Hospital.
Well, hello, Dr. Sean. Nice to meet you. By the way, just so you know, if you have an object inserted into you, I know that sounds kind of weird. If you get stabbed with a knife, if some glass goes inside of you, if a nail goes inside of you, never pull it out. Make sure you call 911, let the paramedics decide what to do, let them take you to the nearest hospital, because a lot of times what that object is doing is preventing you from bleeding out because it's putting pressure on the spot where the artery or vein was cut.
A special meeting of the board of directors. As much as I love you all, questioning one of my hiring decisions, did you bother to look up the definition of president while you were skimming the dictionary?
You're hiring him to be a surgical resident. My department over my objection.
The bureaucracy that you're seeing here is real. There are board members, there's presidents, there's employees, there's trust funds. So these things exist. They put a lot of pressure on doctors and presidents to make certain decisions.
Yes, he has autism, but he also has savant syndrome. Genius level skills in several areas. He has almost perfect recall. He has spatial intelligence, and he sees things and analyzes things in ways that are just remarkable, in ways that we can't even begin to understand. Those are assets, undeniable assets for any doctor, particularly a surgeon.
I'm not gonna lie, I agree with the president on that. As a surgeon, it's more important to have very good spatial ability, to be able to have perfect recall, to understand the anatomy perfectly, than it probably is to explain the complexity of a specific case and be able to communicate well with people. Most of the time, when you're a surgeon, your patient is not awake. That being said, I think it is still important for surgeons to be able to improve their communication skills, to be able to talk to patients, help them understand the risks and benefits of operations, and make sure that they don't force patients to go into the knife when they don't have to.
You seen her?
No, now go away and turn off the light.
Sure.
Ooh. Resident beef. Resident beef. Oh.
I need you to,
I heard.
And here I thought this was gonna be an all-medical show, no Grey's Anatomy drama. At least where I practice medicine, there's different on-call rooms for males and females. There are times where one of the call rooms may be unavailable, and you do have to have a male and a female sleeping in a room together. Usually it's not a problem, but this is unprofessional, folks. It's gonna lead to drama, lots of drama.
We don't have a relationship, we have sex. But
You have a sexual relationship. I wish I had vision like that, that's impressive. Venous distension is caused by increased intrathoracic pressure inside the chest cavity. He's basically saying the veins in the arms are swollen, so he thinks there's some extra pressure going on inside the chest cavity. Can be because of cardiac tamponade, which means that there's blood, usually in a traumatic sense like this, inside the pericardial tissue, which is the lining of the heart, and there could be blood in there and it makes the heart unable to beat properly.
The veins in the boy's left arm are popping.
Is that bad?
I don't see.
Intrathoracic pressure.
No, his chest is rising. He's breathing.
No, the chest is moving paradoxically.
Paradoxical chest movement is a consequence of something known as flail chest. If you get a trauma where a section of your ribs break from the rest of the ribs, that part of the rib cage doesn't move normally when you take a deep breath in and deep breath out. So the chest sort of moves paradoxically. That's what he's talking about. What happens during a pneumothorax, one of the lungs collapses, or sometimes both of the lungs collapse, and you can't oxygenate that area, meaning that when you breathe, no oxygen goes to that area. It causes increased pressure. The life-saving treatment for this is to literally insert a needle in order to release some of that pressure.
Who here has a sharp knife?
Oh!
Blade 5 inches or longer? Nobody?
Is he gonna go into the second or fourth intercostal space?
Can't be back here.
Oh, I need a knife. Where do you keep a knife?
He's going to TSA.
A knife. Sure. Anything else?
I do also need a narrow 6-foot tube and high-proof alcohol and gloves and baggage handling tape, but I'm going to get the alcohol from the duty-free store and the tube from the back of the soda machine.
He's gonna put a chest tube for a traumatic pneumothorax. Looks like he's going to a party with all that Jim Beam. He reminds me of Zac Efron a little bit. I know it's a weird thought to have in the middle of this medical emergency, but I don't know. I always found that blowing to the glove thing really obnoxious. How much bacteria do you have in your mouth? Probably even more than your fingers. You're blowing inside the glove, but you're getting some of that bacteria on the outside of the glove that you want clean or relatively clean when you're gonna go insert a chest tube into a young boy. He's gonna clean his hands with a Jim Beam, but that's not perfect.
Incision should take place 2 ribs down.
Second intercostal space, my man. He's actually following proper technique because you want to stay in the mid-axillary line, meaning in the middle of your armpit. That way you have a lower probability of hitting the heart when you go in with the scalpel or whatever you're going in with.
Okay, well, why the bottom?
The air will continue to leak and accumulate until the damage can be properly repaired. The tube allows the air to get out. The water in the bottle stops the air from coming back in.
A homemade one-way valve. He's breathing. You saved his life. He saved his life.
Attention pneumothorax, you can literally put a needle in that can release some air, and that equilibrium does enough of a job. You didn't need all of this fancy technology here.
I need to get to San Jose St. Bonaventure Hospital.
That's where we're going.
Good.
One of the classic signs that someone has autism or may have autism is they don't make great eye contact. They're not great at picking up social cues. If you find out that your child has autism, you can start them in these early intervention programs where they teach them how to mimic some of these social cues, where they're not looking to make eye contact with you like we do normally because we have good physical recognition and body language recognition, but they do so because they're trained to do so, to make conversations seem more normal. Early intervention has shown some very promising results for those with autism.
Find another school.
No, we won't, because nothing's gonna change. They can't handle him, and I don't blame them, because obviously we can't handle him either. What the hell happened this time? What happened?
You're hurting him.
What did you do?
Those who have autism and grow up with pets actually have better results moving forward in terms of communication, in terms of interpersonability. So if your child does have autism, getting them a pet early on definitely serves a benefit. Comments. The best thing you can do for this channel to help me make more content, to make better content, is to subscribe and then share this channel with your friends and family so that they can subscribe. As always, stay happy and healthy.